So first I want to thank everybody for coming out, all of our wonderful HIMSS SoCal members, for braving, it was raining when I left Laguna Niguel this morning at 5:17, I caught the Metrolink. And then I wanted to, so thank you guys for coming. If we have anybody from the provider side that you haven't actually come to a HIMSS Southern California chapter event, I wanted to kind of welcome you. One of the great things about the chapter, it really helped me early in my career, is I was doing a lot of infrastructure, data center networking stuff, and I was wondering, hey, what are the folks that are like in the front lines, the doctors, nurses, and and the electronic health record, all, what are they? How do they do their work? And sometimes you can be in IT and not really know the business that you're really providing that great service for. So, for me, just getting to hear all the talks and meet all the different people and network and get relationships, I found the chapter to be really amazing with that. And so if you guys, if anything, you hopefully you'll learn a few things today. But I do want to encourage you guys to support the chapter. Look at it becoming a member in Southern Cal. I think we have about almost 3,000 members right now, so we're growing. And then lastly, before I kick into some of the slides here, is I wanted to thank our vendor partners. So it's everybody in the back. So make sure that you guys have a chance to stop by and look at what they're offering. It's probably, since it's a security conference, so I would imagine a security service or tools or solutions and stuff. So we couldn't do these events without you. And really, as I kind of unfold some things today, we can't really go into the future without a partnership together. Exploring the unknown, kind of Star Trek-y thing. Okay, so let me get my clicker. Okay, so the title of the talk is Security Innovation, the Road Traveled for the Public Health Sector. So, yeah, it's going to be definitely applicable to the public sector, but I do want to just kind of level set that if you're not in the public sector, then you don't have to leave the room. This is for the private sector also. And if you're not in the public or private, maybe you're in some other kind of universe, this applies to you too. So anyway, conflict of interest slide just in case. Yeah, so I'm coming in here totally objective. So what I'd like to cover today is just a little bit about how healthcare is in transformation, which is really being driven by innovation. I do want to just, if you guys don't have access to Gartner, I wanted to show you guys some of the hype cycle recent data about like what's new and what's going to be coming into production and hitting our healthcare organizations in the near future, or it's already there, or maybe it's 10 years or plus out. So it's important to know that, because we could be spending a lot of time on stuff that it's 10 years out and nobody's doing anything other than tinkering and toying with it. And then I want to give you guys a couple of real quick slides on a novel cybersecurity approach that I believe as we forge into that digital age, which it's thrust upon us by retail banking, and so we have to go there in healthcare, and we've already started. It's a different way to look at how we approach cybersecurity and risk and trust, risk management, and how we deal with trust. So I think you guys can resonate with it. I'm not aware that this approach is actually anybody's actually using it per se, all of it, but it kind of picks a lot of different components to look at the future, like maybe 10 or 15 years from now, and say, what is, or maybe 5 years, 10 years, how are we going to approach cybersecurity in the future? So it's a little bit of futuristic stuff. And then I'll just kind of wrap it up with kind of what's going on at LA County Department of Health Services as far as how we're approaching cybersecurity, like the innovation and the transformation into digital, and then the fact that, hey, we got to do basic stuff. And I'm not saying this about our organization, but how many of our organizations we have people in radiology or imaging, and they're just putting stuff on unencrypted drives or USB sticks and throwing it in file cabinets and saying, well, it's secure because I got a lock on the file cabinet. So, so in a lot of ways, what's in the future is cool, and it's coming, but there's a lot of basic stuff we need to do right now, so I want to kind of cover that. And then, so how do you know where you're at? So there's a way that if you guys, anybody went to the HIMSS Cybersecurity Forum, I did this stuff. I talked about how to know what your report card is. Are you an A+? Is your organization like getting all A's? Or if you're in high school, I have a teenager, by the way, and they're taking AP classes, you have a 5.0, but is it necessary to get a 4.0? And so we'll talk about that. And then just a couple of tips on how can you get started assessing yourself. And of course, there's a lot of frameworks. There's the cybersecurity framework, medical device. The government has come out with a new medical device framework. And so there's a lot of things we can use, but so there's a lot of work we can do right now. Okay, so I used up all my time. Great seeing you guys. I'll talk to you later. No, okay, all right. All right, so I know that Jerry stole a lot of the stuff I was going to say, so I'm going to go through this really fast. Okay, so LA County, this was the first hospital back in 1858, I think it was, so it's been around for a long time. And I was in Southern California for like eons, and I didn't even know about LA County and the Department of Health Services. So they do a good job of actually, in a lot of respects, not everybody's really aware of what they're doing. So it is a safety net hospital system. It's the second largest in the country. So here's just a few facts and figures. We do cover the 10 million residents, almost 5,000 square miles. There's a lot of beds. I didn't realize there was that many hospital beds. There's almost 2,000. There's only 5 in LA County level 1 trauma centers, so LA County hospitals have 2 of them. A very robust National Rehabilitation Center down in kind of down in South Bay area. 21 health centers. We also do also run the EHRs for the Department of Public Health, and they have about 14 health centers. And as you can see at the bottom, we do all the health care for the jails. So LA County has about 2,000 inmates at the Correctional Health Services. All the foster care system, juvenile hall. There's a very strong alliance with USC and UCLA with a residency program, so it is an academic medical center / teaching facility. So lots of smart people in the organization. They're dedicated to serve, our patients and work with our people. So as I mentioned, it is a safety net hospital. So we've got about almost 500,000 impaneled patients. We only bill about 5% of the people that come to our hospitals and clinics have the ability to pay. So we do a lot of actually we're up to about $6 billion in revenue, but we really get our funding from government and federal programs and Medi-Cal and that way. And then it's pretty big, almost basically around 30,000 people, so. Okay, and here's some lovely pictures of the facility. So if you haven't been to one, hopefully you won't be going to one for a lobotomy or brain transplant, but you can always drive by and see kind of how they are. So I don't know if you guys remember Marcus Welby way back in the day, As the World Turns, or I'm not sure what the program was, but that old hospital is actually still there, but it's not used. The county built a new hospital in 2008, 600-bed hospital. It's really nice, very busy. It's got about 3,000 nurses, and so it's kind of right next to it. So, but that other building is the big white building that I'm familiar with, is a historical landmark, so it's going to be around for a while. And the reason why we had to move it is because of the I think it was the Northridge earthquake. Okay. All right, so let's talk a little bit about healthcare and security, why you guys came today. It's great to hear about the county, but Okay, so we need to think a little bit differently, so I just wanted to kind of throw this picture out here. And although there isn't a drawbridge with a bunch of knights and, like Lord of the Rings people that were missing from the picture, they must have left when I took the photo. But anyway, this is kind of like the traditional way we just put a moat around something, a big wall, and, and hope that nobody comes in. So as you guys already know, that's not the way that we have to do security now. We have to think differently, and that's because digital is thrust upon us where it's anytime, anywhere, any device. People are accessing services that on devices we don't own or manage. We've got the cloud servers that we don't manage, so we have to find a way, and how do we do things a little bit differently? So this paradigm is kind of gone. And here's just a quote from last week from Christopher Wray, who's the FBI director, really just saying, the problem that we have in cybersecurity is huge, and it's bigger than even the government. Okay, now that's pretty big, okay? And what he was asking for is, public and private partnership. We need to kind of all work together because, we talk a lot about how technologies are advancing and increasing, but we don't necessarily always talk about how the adversaries and the attackers and hackers, they are getting more sophisticated, every week. And so, we have to, our very humble, security staffs that we have in our organization, and maybe you're using managed security services, it's really difficult to keep up with nation states and very sophisticated adversaries. But I believe that we can do it if we all band together. So from a public health perspective, I'm just encouraging everybody to, let's work together. And that would include education and academia. I know that some of the universities are offering programs now in cybersecurity, and so we can train people because it's not like you can enroll in the average college and have a cybersecurity major. So so we're looking. I think there's a lot of focus now on how can we get our skill set level up, because one of the big challenges for healthcare organizations is where do you get that top talent that can match head to head with some of these sophisticated hackers? And to be honest, the government probably has a lot of them. I know that, we're looking for those, and I'm sure you guys are too. Saying hi to my friend here. Okay, so let's just talk really, here's just a slide about healthcare is being driven by digital, and so we're moving rapidly into this era, or into this state. So here's a few things that I thought you guys would resonate on. What is emerging innovative technologies that are kind of have the digital theme? So we've got AI, Internet of Things, cloud computing, wearables, big data, serverless computing, containers, Kubernetes, blockchain, et cetera. So there's a lot of interest, a lot of excitement about these, and there are things that are just beginning to kind of take place with these. So what I thought I would do is just maybe level set a little bit, and if for those of you guys that are Gartner subscribers and you already have all of these hype cycles memorized, and you have my permission now to go to sleep, the rest of us kind of will, and I hope you can see this, but let's just take a look at a few things on where some of these innovative technologies are. So just to make sure everybody understands what is the hype cycle, I want you guys first to look at the 5 columns. On the first one on the left, it's the innovation trigger. So that's basically where there's the y-axis of expectations and the x-axis of time. That's where new products and services come to the market, and there's a lot of hype. There's a lot of interest. So you'll see that the curve basically goes really up really fast. None of these things are actually in production very much at most places. So they're maybe a proof of concept. There are a lot of them are just kind of just getting started. But we do need to realize that they're there and then prepare for them. And then probably in some cases you can get the bad guys using them. Then what happens is that in the next column you get what's called the peak of inflated expectations. That's where it begins to get implemented by some organizations, some locations. And then the expectations plummet typically, and this is over time, this has proved itself out time and time again, because there's a lot of problems with operationalizing these technologies or spreading them or getting them to actually work. So that they don't hinder the use of technology. Because we always have to remember there's a balancing act between the appropriate level of security and then letting people do what they need to do. So if we have too much security, then that's a problem. Anyway, so typically what happens is it plummets back down to almost where it started as far as expectations, and then into the trough of disillusionment, and then it gradually moves forward into the last 2 sections, which is the slope of enlightenment, where it starts to get more mainstream, and finally it gets to the plateau of productivity, which is where standards are developed. This is where that technology is commonly in place. So for instance here, speech recognition, should be pretty mainstream. So when you guys are looking at these, I have 6 technology hype cycles and 5 security hype cycles. So we're going to go through them really quickly. So my goal is not to go over each bullet point and have your neighbors, nudge you guys, wake up, when is this going to be over? But I wanted you to look at this kind of like you can blur your eyes a little bit and see where's all of the writing. Is it to the left, to the right, to the middle? Is it spread out? Because that'll give you a good idea of kind of where this particular capability is at. And then also pay attention to the dots on the line. So you've got, there's not a lot of white dots, they're generally to the right. That means that it's kind of already here. Then you got the light blue dots, and then the dark blue dots, and then the gold triangles. And by the way, I'm gonna make these slides available so you guys can memorize them, and then when you get home, talk to your spouse or your kids, you can kind of like, floss and tell them how much you know, and they'll be very impressed. Okay. Anyway, so when we're looking at these, just kind of look at what's dark blue, because dark blue means that's 5 to 10 years out, or even yet, like if it's a gold triangle, we're talking 10 years. So really, it's we're looking at what I'd like you to do is just look at a lot of these things that there's a lot of talk and hype. If you went to the HIMSS the last couple of years, it's on cognitive computing and AI. It's kind of every conference we talk about it, but that's not necessarily what everybody's dealing with. So if you're a security vendor, and I would really be interested in your guys' thoughts on, in reactions to some of the stuff I'm going to share today, is that the stuff that you're getting clients asking you, hey, we have this need, or is it like at a whole nother level? So you come to like Southern California HIMSS and you hear this talk on, innovation and all this high-tech stuff, but then your day-to-day work doesn't necessarily involve a lot of it. And then it's also important to know, for those of you that are in management, when you're talking to your boards of directors or your leadership teams, helping them understand what do we really need to do right now, and then how can we position ourselves so we don't cut ourselves out for the future. So because we are going to be moving. Anyway, so you can just kind of see here. I think you guys can just kind of look at the various things here. Yeah, smart robots are just beginning. Governing AI is just kind of at the, we're just learning how do we even govern that? And we're seeing things that had a lot of hype, like virtual assistants, machine learning. Those things are autonomous vehicles. Those things are kind of in the trough of disillusionment. So, but not much in the slope of enlightenment and plateau of productivity. So as I go through a lot of these, you're going to see that there's not a whole lot in the plateau of productivity. It's pretty much empty. But there's more things depending on what the capability is in the slope of enlightenment. So that means that some things are being deployed. Okay, so let's take a look at cloud computing. And by the way, these are from July of 2018. So take it with a grain of salt that there might be some movement in the matrix, kind of a little bit. Okay, so cloud computing, definitely we've heard a lot about that for a while. I think we see more maturity with platform as a service, infrastructure as a service, et cetera. And infrastructure as a service actually has been moved into pretty much mainstream. But if you look all the way to the left, so blockchain, platform as a service, serverless computing, these things are edge computing. These things are just now beginning to get some visibility. And then you guys can look in the middle here. Okay, let's look at Internet of Things. So definitely Internet of Things is something we have to pay attention to, because the attack vector and this, the complexity of what we have to manage with our data and our systems and our, and the users we have to kind of stay on top of with the Internet of Things is huge. So this is an immediate threat, but you can notice that there's a lot of the things that would secure it and govern it. It's not there. Like if you look on the far left, these are very new and emerging areas of how do we stay on top of IoT. So we've got a lot of work to be done there. And nothing in the plateau of productivity, but then there's a few things, probably not what we need at this point to manage, what we're seeing as, an ever wave of, adoption here. So we definitely need some attention in this area. Okay, wearables kind of is a subset of IoT, but I thought I'd just show you guys this. So definitely this is heavy left. All right, so a lot of things are still in the innovation trigger area. Biometric earbuds, I guess that's kind of on the way down. We got fit trackers and things, so and those things are beginning to gain traction, but a lot of the things that we need to stay on top of, or really to be clinically relevant, improve care and to change health outcomes, and I think that's what a lot of the wearables are designed to do. They're very much in its infancy. Okay, and then two more here, mobile technologies. You can see 5G is over there. We're just getting started with that. Authenticating Internet of Things, that's kind of new. Emotional AI, powerless charging, it's kind of interesting. That's in there. And then, like I said, not a lot on the plateau of productivity. And then many of the things that we have been using mobile devices for, they're trying to find their way. So they're kind of heading down the slope of disillusionment. But hopefully they will kind of round out and get back on track. Okay, and then I wanted to put this in here. It doesn't relate to necessarily a technology capability, but these are the things that healthcare providers are saying that they're looking at. And I see some of you guys taking pictures. These slides will be available. So you can see on the left, there's a lot of things for patient care, like 3D bioprinted organ transplants. Another interesting thing is blockchain in healthcare. So there's I'm not going to be spending a lot of time talking about blockchain today, but that's because it has not that it's not important, but it does have a gold triangle, which means that's after 10 years. So this is Gartner's opinion. Let me see anything else here. Genomics, that's just hit the top of that top curve there on expectations, and we're beginning to see that, how do we get this to really get value out of it? Nice to know, though, open notes is, it's really important. We're finding that in the healthcare area. Patients want to see what's in their progress notes. They want to have that more visibility, more information is better, and we're finding physicians, not being freaked out or concerned that they saw what I wrote in the note. So we're seeing it's being adopted. Okay. Okay, so what I'd like to do now is just kind of look at where are we in the security space from a hype cycle perspective. So when it comes to cloud security, you can probably guess that security in the cloud is actually much better than maybe public perception or your executive leadership or your board. So moving healthcare to the cloud is actually better than maybe the public perception. So there's a lot of capabilities on the security side that are far right, so I think that's positive. Not a whole lot. There's chaos engineering and identity proofing and collaboration, immutable infrastructure, cloud security posture management. So some of these things are kind of new concepts, and I think as we put more of our intellectual property, we have more dependence on the cloud for being able to deal with that mass quantities of data, volume, velocity, and veracity and variety, then we're going to see some of these. We'll probably see some more emerging technologies on the security side. So I think we're doing well there. When it comes to data security, now it's a lot more about not just devices and networks and servers, but really there's more of a focus on data. So where are we with data? We can see that. Like we know that we'll talk about DevOps in a second, where we integrate operations, the business, and IT in developing applications, and it's really one team, one group, one concept, kind of pulling these things together. But data ops, okay, so we're kind of young on how do we manage our data. A lot of organizations have trouble standing up, their data governance. They've got a lot of customization with their EHRs. They've got silos. Everybody's kind of running their own analytics. So it's a little bit like the Wild West in that sense. So we're going to see more maturity when it comes to getting organized, getting more structured around data. But on the security side, we need things such as DLP. We need digital rights management. We need CASPs or cloud access security brokers. So all those things are important. And another, see if this has a pointer here. Cool, I didn't know this had a pointer. Okay, so we can see user and entity behavioral analytics. So instead of just tracking devices and, giving somebody a pass into the ballroom, so to speak. One of the things I'll share real briefly is that security needs to begin to track, the activity in the context of that session or that interaction. And so it's really important to understand, what are the users doing? How are they behaving? Are they doing something that they normally wouldn't do? Like, when was the last time you went to fill up your car with gas in China, with your credit card? So that's obviously like, ding, ding, ding. So this is where we can begin to, profile appropriate behavior and then alert, the appropriate people if it's inappropriate. Okay, endpoint and mobile security. So once again, we've got the mobile space is a little bit more mature than wearables and Internet of Things. So we're seeing, data loss prevention, secure web gateways, smartwatches, et cetera. So there's either they're coming down the trough or they're coming up. So we're seeing a little bit more maturity here. Definitely this is important. I know prior to me coming to the county, one of the things we were working on was browser isolation to be able to give people access, like doctors access to their personal email, so that they wouldn't be motivated to, use the like unencrypted USB sticks or secure texting and things of that nature. So I think that that's kind of a new capability. I'm not sure everybody's using it, but you can kind of see where it lands. So there's a lot of expectations on it. I think it's got some good potential. I'm hoping if it does drop down into the trough of disillusionment, it'll just be a really quick magic mountain ride downhill. Okay. And two more real quick here. So this is a look at the application security. And we can see that we've got chaos engineering just beginning to get started. How do we manage our threats over APIs with our third-party vendors and those systems as we connect them together? But there is a fair amount that's being more matured on the right-hand side. And then what I wanted to do is also just share the threat-facing technologies. So these are technologies that Gartner's kind of pulled together that actually defend against attacks. So we're seeing that we've got some maturity and with SIMs, with denial of service defense systems, encryption. Obviously, we're doing good. Vulnerability assessments, endpoint protection. But there are some new things coming up. And then we still have some work to do with expectations on network traffic analysis, for example, like do all devices at all points along the continuum, so maybe the firewall, then looking at the servers and the databases, are we analyzing the traffic and really seeing what the activity is? And so most of our environments, we're not, once we let people in the door, with that initial card entry and password, or maybe it's something like a dual factor authentication, then for the most part they probably have access to the whole network. And we're not, even if they were VLAN off or there was some segmentation, we're not necessarily monitoring their behavior, what they're doing. Have they gone to someplace else that they shouldn't go? Are they doing file transfers or accessing other systems? So our identity and access management systems, are they tuned in and noticing these things? Probably not. So some work we have to do. Okay, so what I wanted to do is just very briefly just share with you guys a conceptual approach, a strategic approach to addressing what I believe is going to be in the future, but you can start thinking about it right now. So if I get too academic for you guys, then just let me know. Okay, so the approach is called continuous adaptive risk and trust assessment, and I've kind of alluded to it in some earlier comments. So this is where you approach security from a risk and a trust management perspective, where there's an understanding that there's no perfect attack authentication or perfect attack authentication and invulnerability is not possible. So in other words, you can't get that A+ in your report card. You're never going to necessarily get eliminate all security risk. And then because we're moving to digital, it's important to understand that we need to be able to approach security quickly, adaptively. We need our systems that are on the security side to talk with each other to understand the context. And in order to be able to say, you know what, I trust you for this moment. Now, maybe in a minute from now, I'm not going to trust you, but you know, we have to have systems in place that can intelligently make that that decision. And then because there's so many devices, there's so much data, we have to leverage the cloud, we have to leverage artificial intelligence and machine learning, because this is just too much for your average security analyst or engineer. And there's no way that humans can stay on top of this, so we need to kind of leverage all that stuff we just looked at, AI. And then ultimately we need to have the business understanding that, you know what, it's your job, you're in charge of the risk and the trust and security. And so you guys, let's make the decision together. We in IT and in security are not going to be just wearing police uniforms and just protecting you, and you don't have to think about anything. So really, there's a lot that they have to think about. All right, so there's 7 imperatives of this strategic approach, so I'll just go through them really quick. Replace one-time security gates with context-aware and adaptive programmable security platforms. So I mentioned that it's once somebody gets in the door, if you authenticate them appropriately, that's good, but it cannot end with just you're in, you're carded, so you're good. Number 2, it needs to be the entire session, the entire experience, it needs to be continuously where there's technologies in place to monitor and observe and to notice what's going on and is there something that's not appropriate. And that would be, proactively, and then as well as if something bad happens, you got to be able to jump on top of it. Third is we need to go ahead and look at risk assessments early on in the process. So in other words, when our software teams are developing code, or if somebody wants to procure a cloud service, you need to go look, it needs to start at the beginning. Don't wait till it shows up and gets on the loading dock, or it's already been in use. So a lot of times we don't necessarily have all these things in place. And then in addition, we need to look at the full stack. So it isn't just enough to look at the endpoint and the firewall, like with that moat, but you really need to look at all points of all technologies of wherever the data is traveling. You need to know what data is important, and because you can't really protect all data, just the important stuff. So for us in healthcare, it's, what is it, PHI? So we need to know where our crown jewels are. And then because, as I mentioned earlier, there's so much, there's so many devices. One organization, I won't name the name, but they estimate that there'll be 1 million devices, Internet of Things, in the organization probably within the next year or two. So that's a big organization. That's a lot of devices to stay on top of. But I challenge you guys. Even if you're a small to mid-sized organization, you probably have a lot of there's personal devices, there's cloud services, there's a lot of things that you have to stay on top of. And so we need the automation, the orchestration. We need that machine learning. So all that stuff's that's on the left of the hype cycle. We need to, for those of you guys that are in the vendor community or that are in research that are working on developing these things, please go forth. What can we do on the provider side to help you, other than say, oh, here's our data, you guys can use that, and then hopefully not hurt our patients if you're going to come in to do proof of concepts and things. So we do have to take care of our patients. So if there's ever a hesitation about like doing things inside of a healthcare system, it typically would be just to make sure that we're protecting our clients. Okay, and then number 6, architect security as an integrated approach, not silos. So all the systems that a lot of them are siloed, and somebody asked me, is there like one security vendor that just kind of does it all? So I could pick any of the names of the vendors here that are sitting in the back, the amazing, awesome work that they're doing, but I don't know that any of them have the full stack of everything across the board. So we have to find a way for these intelligent systems to begin to talk with each other, to work with each other, and then as a client or as a healthcare provider, we need to set expectations on what is it that we're looking for. So a lot of these things They may or may not be in production today. They may, there's tools, there's zero trust software defined perimeter, capabilities that are out there. But you can work with your vendors, you can work with your, partners to say, this is where we're at right now, but we really need to go here. So, show me the plan for the future. How are you going to integrate? How am I going to see, kind of like those Mission Impossible movies, or where they've got the camera and Benji's kind of on the doing some things on the computer, and they've got everything. It seems like they got everything under control. They're monitoring, but they've got a lot of visibility. Okay, and then last, as I mentioned, we need to put all of this information and make sure that the leadership on the business side knows that it's their responsibility and they own it, or a product owner. So we are moving more towards, instead of IT projects and security projects, to products. And so I think where we have full ownership of the entire solution, and it's a joint ownership by the business as well as by the technology security folks. Okay. All right, so we're almost done here. Anybody need a coffee break or caffeine or, okay. All right, so how does that affect, let's just say, how does it affect Jim over at Department of Health Services, or how does it affect you? And should we be concerned? All right, so I'm gonna go through these really fast. So one thing about this slide I wanted to bring up is that, there's a lot of visibility on data breaches and things that are happening, and I think Richard Greenberg from the Department of Public Health is gonna give a talk on data breaches later today, so he'll give you all kinds of good info on that. But when things happen inside of healthcare, they actually can hurt people. So a lot of times I think we just, if you lose your credit card, somebody, puts a fraudulent charge on one of your accounts or something, you can just call up and get it changed. It's not like you're hurt, but we have medical devices, we have implantables, we have things that actually can, if some of our pump systems, get compromised, you can get wrong doses, so we can kill people. We can really, bad adverse outcomes can happen. So we really need to see that patients can be harmed, and so I think that's an important thing to just kind of call out. And then a lot of times boards of directors and leaders will just look at it from a financial, reputational, or maybe regulatory perspective, and so we need to say, they're all together. The costs are getting higher. I think right now it's like $3 to $4 million the average breach. What the cost is. Facebook, lost $100 billion. That's 20% of its revenue for the infamous Cambridge Analytica incident. And then with GDPR coming to the U.S., I know it's kind of here already, but 4%. The fine can be 20 million euros or 4% of your revenue. And so for a company like Amazon or Apple, they're making like whatever, 800 million or something, 800 billion. So it's, you're talking large amounts of money here. So nothing to be, nothing to kind of wink at. And then last bullet down here is by 2022, you guys can read the other ones. So cybersecurity ratings will be as important as credit ratings. So some interesting predictions here. And then 2021, somebody's going to be on the news saying that they got hit for $1 billion in revenue for a ransomware or malware attack. So, okay, so obviously we know that you guys are here today not because of the croissants, but you're here because you really want to kind of find out what's happening in the cybersecurity community, networking, et cetera. But for those of you that are on the customer side, the provider side, how do you know really where you're at and what you should be focusing on? Should you be spending all your time on neural networks and blockchain and ignoring everything else? So one thing you can do, and that we're doing at the county, is kind of assessing, well, where are we at from a report card status? So I already mentioned there's no such thing as perfect protection. So it isn't like you have to get an A. But it's important to make sure that we communicate to our business stakeholders that security is your responsibility. I'm here to help you with it. I'm here to kind of translate. I'll partner with you, but it's your decision. It's really about how much risk do you feel like you're willing to accept. So in order to get that conversation going and to help them see it, because if you just bring it up, they're going to be like, okay, so what? Then you have to kind of break it down in a way that they can understand it. So it's going to be under, you have to help them understand what is their risk exposure, and I'm going to go over some slides that talk about that. And then you need to, once you see your exposure, you're going to take a look at what is your security maturity, and there you can kind of cross-reference into to a reference architecture, and then you can come up with a strategy on, what should we spend our money on? Because if you just say, we need to spend a bunch of money, they're going to, most likely the request to get another tower built or more beds or hire more nurses, those things are going to go before all of your blockchain requests get approved, okay? Okay, so if we look at, let's say you're in an organization and you're on the client side, so if you're on the vendor side, you can just kind of like, this is probably a typical conversation you're having with your clients. So on the red on the left, that means you're getting an F, and on the green on the right, you're getting an A. So you're doing really good as far as how much risk you have. So high risk on the left, but you're probably not spending a lot of money, and you probably don't have a lot of sophistication in your security tools. On the right, you don't have a lot of risk, but you've probably spent some money, unless your organization is in Antarctica. By the way, it was minus 45 degrees the other day in Antarctica. But and it's just you and the penguins. All right. So, but if you're not in Antarctica, most likely you've got some mature security technology in place. Okay, so you can be at any one of these three places. I'm just picking 3 points on the map here. So you can be a small mom and pop shop, not very complex. So maybe it's okay to be in the red. So, for your organization, your leadership, they could, maybe it's an F for like Amazon, but it's it's an A for you. So it's okay to be all the way to the left. But potentially you're growing, maybe you were on the left, now you need to be a little bit more on the right. So, the larger you get, the bigger the bullseye that you're going to have on your target on your back. So it's important to know, like, what size is your organization, what's the risk appetite, because your leaders are going to want to know, they have to hear it in business terms. You can't just come to them with spreadsheets, cool terms of that they're seeing in magazines, but they don't see how it really is going to impact them. Okay, so so the goal is to really identify where you are on the continuum, and then to reassess yourself on this continuum with your your organization, so that they can kind of know what where their risk appetite should be. Okay, so first I have two questions here. So if you ask the question, won't all business units just select the lowest level of service, risk, and cost? The answer to that is no. Why? Because if you put the responsibility of security and its outcomes on the business unit, then they're responsible for the outcomes, and they're not going to be wanting to get their heads chewed off or have that on them, that it's actually their responsibility. So it's really key that you help them understand that it's their responsibility. And so, but what about the business owners that they will just say, okay, let's just get the state of the art, the gold standard. Let's just spend everything we got on security. Well, is that going to be productive? The answer to that is no. Okay, why? Because security is something where you can't buy your way out of it, because there's no perfect protection. There's an A+ in security for you may not be what it is for the next organization. So you basically need to understand that it's important to understand that no amount of money and tools and technology and of that is going to really make is going to be the one to make the difference. Okay, so as you're kind of having this conversation with your business leaders, it's helpful for them to understand this slide here. And I think it's kind of a cool slide. I use it from time to time. So this one shows the security maturity into 5 basic levels. So if you're just getting started on your journey, then you're developing, you're going to level 4. So level 2 would be you've got a CISO, but level 1 you don't have a CISO. So some practical things where you can kind of say, where am I? Where's my organization here? And you can see that as you go through each of these levels 1 through 5, you're going to have your security maturity is going to improve. It's going to increase. So that means you're doing good. But The risk, also if you look at risk and kind of overlay on that, then you're going to see that there's a high amount of risk at level 1, but it drops as you go and travel to level 5. So the amount of money that you have to spend and the amount of effort that you have to put, really you can look and say, what is that inflection point? Where is that intersection? So that's where you're going to get your return on investment. So you don't really want to be spending, like if your risk is, let's just say on level 3, is that is that red line. So you've got some room on level 3 based on this chart where you need to go ahead and probably spend a little bit more money. So if you look here at the cost curve, also you can see as you spend money, then it's kind of directly related to your security maturity, but you don't really want to spend money on security and capabilities when your risk doesn't merit it. So, and that's, like I said, a decision on the business side. Okay, so in order to understand your security maturity, you need to have something to map it with. So here's kind of a way to kind of paint a lot of the major areas that the business can resonate with, and their confidence in IT and IT security's ability to deliver on these services. So kind of a reference architecture. And then underneath of these areas, you can get very specific, and you can bring up each of these areas. So you may or may not want to get into detail if you're dealing on the business side with executives, but it is important to talk at the high level, but sometimes they do need examples. So let me just, let me pick a good example here. Let's just say looking under asset and inventory management. So one of the things that we found, at least I found in healthcare, is if you don't know where your crown jewels are at, if you don't know where the PHI is at, then, and you don't know who owns the systems, you don't know if their phone numbers, you don't know, how to contact them. If you do get hit with some type of an adverse event like ransomware or something, where is your exposure? And so it's really important, if you don't have a robust asset management inventory, then you can talk to the board and say, we've got to have visibility into where our important assets are and where the intellectual property is. Because if something, in California, we know that we have a problem with earthquakes and fires, right? Is it possible to always prevent fires? Is the fire department completely focused on preventing any at all occurrence of fires? No, they can't, because anybody can start a fire. But what they're going to do is they're going to be fast responders. And so in healthcare, we need to be the same way. We can't stop. If a hacker gets in and uses social engineering and they kind of penetrate in, they made it through the firewall, they got credentials. We can't, and so if something gets deposited, you can't necessarily stop that from happening, but you can have a continuous context aware, visible ecosystem on the security side where you can detect that immediately and jump on it. So I've been in organizations where we have been hit with ransomware. But the good news is that we detected it quickly within minutes, and then we were shutting down ports and jumping all over it. And so it's really about minimizing the damage. So I think this is an area where it's one of many areas. It's getting a little bit into the weeds where you can demonstrate to your leadership and on the business side that if you need some funding to get, like for instance, an asset management program in and get staff to kind of ramp it up, then you can help them see that if we don't do this, then we're not going to be able to react quickly, and then we're going to have an adverse event. It's not if, it's when, and then we're going to have less than desirable results. So we can kind of minimize it. So I think it's a good kind of way to map these together. One way to do this is through when you use this maturity model, you can kind of see where you're at, and then you can come up with a strategy on what's the go forward. So here's one way to do it. I'll show you a slide in a second, where you have governance, planning, organization, controls, engineering, et cetera. And the blue line is where the benchmark is, and the green line is where the absolute minimum that's needed in order to be, for risk acceptance. And so what you do is, we'll go to the next slide here, and it kind of shows how to use this. Okay, so here we have a different set of criteria. It's app security. So these are kind of security services. But if you look at the black kind of squiggly figure or shape is kind of where you're at. So you've done the assessment, and so this is where you map out your organization out. So you're doing pretty good in change and configuration management. You're actually doing more than you should, actually. Physical security, you're good. Governance, you're good, because the risk is that pink shaded area. So those are the areas where you're actually at risk based on the risk appetite. And then if your goal is to get to the gold shaped area, then what you need to do is, so we've got 4 different areas here that are protruding past the gold and the black areas. You can go ahead and quantify that with maybe resources, quantify it with capital tools, security tools, et cetera, and you can come up with a plan on that you can bring to your leadership or board of directors and say, this is where we need to put our focus on. So like I said, there's a lot of things that we can be working on. And so how do you prioritize that? Well, it's important to use tools like this, and this doesn't preclude the NIST framework or ISO or 2700 or any of these other frameworks or models, but this is something you just kind of lay on top, and in order to know, like, how do I know what I should be spending time on, and how do I convince the people on the business side? So does this make sense, everybody? Kind of, okay. Okay, lastly, finishing up here, I've got minus 1 second here. Okay, so four closing comments. So cybersecurity, we're never going to be done. So it's a continuous journey that we're on. You do need some type of structure in order to get funding, in order to demonstrate where the state of the organization's at. Definitely security is not a checklist. I think I heard Clearwater Compliance, it's a great security organization, gave a talk, and they were talking about how OCR had all the fines for, I think it was in first half of 2018, were basically because 80% of the organizations got fined. I think it was like 54 or something at that time. Were fined because they either didn't perform an annual risk assessment, or the one that they did perform. Joanne says I have 5 minutes. I'm going to finish in 3 minutes. Okay, beat expectations. But the ones that they did perform, they were not OCR quality risk assessments. And we just talked a little bit about the CARTA and the continuous visibility. This is where we need to go, and we still in this country are getting organizations fined because they're not even doing the first grade or kindergarten or nursery school level work that needs to be done. So a lot of this, not to repeat myself, but a lot of the things that are in the future, hopefully, technology will really help us, but we do need to take ownership from a business perspective. The CISO and other leaders, really need to peer up with the organization's leaders and really help them understand that it's a business problem. You need a structured approach. I just gave you guys a couple of frameworks, a maturity model, where you can kind of come up with a strategy so you can develop, requests for funding, and so we just went through at Department of Health Services a assessment. So we kind of did this thing here, and we're going to be looking at the results of it, I think next week, and then we're going to come up with what we think might be a multi-year plan on how to, take us from the risk status that we're at this point and the level of trust that we feel like we're comfortable with to where we need to be. And of course, that's going to be a moving target, because if it's a multi-year plan, and we say 2 years from now, maybe the way we're thinking right now, 2 years is going to be different in 2 years, so we may have to make an adjustment. So anyway, so hopefully everybody here is going to get an A in their security maturity level, but if you don't have an A, that's okay as long as it meets the risk of levels of your organization. So here's just a framework that you can use. Structured approach: identify, protect, detect, respond, recover, were those various categories that we talked about earlier. And the last slide here, another good slide for your business leaders. Boy, they're looking at me over there, scaring me. Okay, all right, so here's 3 levels that one could be at if you're in healthcare. So you can, from a maturity perspective, so I would say that for sure, that the one on the left, that's like table stakes. We all need to be doing this. So perimeter firewalls, access controls, et cetera. But if you can get the organization to the second group, you're doing good. You really want to be there, but it's you'll still be in business, hopefully, by December 2019 if you're not in that second category. But we definitely want to get to advanced, but don't worry about the advanced if you're not even at the first on the far left. So I think that's something where a lot of times people just don't understand about security. They can't understand the words and the acronyms. So this will kind of help business folks understand kind of what are the things that they should be assuring that's happening in their business unit, their department, or whatever. Okay, so anyway, and that concludes my comments and my talk today. Thank you guys for coming and being a great audience and staying awake and being attentive and really soaking in those hype cycle graphs and memorizing it. There will be an exam afterwards, okay, as part of the raffle. Okay.